All right. So my name is Nikki Ramirez.
Wait, you want to turn the light on?
No, we're on.
Oh.
My name is Nikki Ramirez, and I am doing a head-to-toe assessment on my very willing husband, Dirk. I had a long day at the hospital, so I have already taken a shower, so please just imagine that I am in scrubs. And he had a very long day at the plant, so just imagine that he is in, it's my nursing assistant. Okay, so, hold on, buddy, you have to do this. Okay, do you give verbal permission to participate as a model in this assignment and be recorded for school purposes for Aspen University class N495?
Yes.
The assessment is intended to show my skills with the assessment actions only, is not to be used as direction for your health status or follow up with any irregular findings. Do you understand this?
Yes, I do.
Okay. All right. So please go ahead and state your name, first name, spell the last name, and your date of birth.
Dirk, R-A-M-I-R-E-Z, 4782.
All right. Okay, Mr. Ramirez, how are you doing today?
I'm doing good.
Okay. Any issues going on that you would need the doctor to know about?
No, ma'am.
All right. 97.3. I'm just going to start taking your vital signs.
Mm-hmm.
Excuse me, sir. That type of harassment will not be accepted in this setting. Let me see your finger. You have any pain right now?
No, ma'am.
Okay. How's your urine looking? Is it clear and yellow?
Mm-hmm.
And when was your last bowel movement?
30 minutes ago.
Great. So your oxygen is 96%, your heart rate is 89, and we're about to find out your blood pressure. Now, have you experienced any pain in the past week?
No, ma'am.
All right. I'm going to go ahead and just put my hand sanitizer on so that we get started. And like I said, my name is Nikki. I am going to be your registered nurse today. I'm going to do a head-to-toe assessment on you. Is that okay?
Yes, ma'am.
Okay.
Can't wait.
All right. Pressure is excellent. 116/70. So, first thing I'm going to ask you to do is just keep looking straight ahead. Ouch. I'm going to assess your face.
Mommy.
I'm not mommy, I'm Nurse Nikki.
Mommy.
So I'm going to assess your
Mommy.
face.
Mickey.
Okay, well go watch your Kindle. Go watch your Kindle.
Mama.
Okay. So I'm going to start feeling on your face. Lift your chin up for me. Swallow. Feel no nodules, no goiter. He's got strong pulses. His face is asymmetrical. So what I'm going to do now is I'm going to check for TMJ. So do me a favor, open your mouth and move your jaw from side to side. You feel any pain or tenderness when you do that?
No, ma'am.
Okay, and there's no swelling, no increased heat, no redness. So look up again. Trachea is midline. All right, so we are going to move down. So what I'm going to do now is I'm going to assess your fifth cranial nerve. So do me a favor and clench your jaw real tight. Okay, you have any pain when you do that?
No, ma'am.
Close your eyes for me. Tell me where you feel.
The left ear.
Okay.
The right eye. The nose.
Perfect. Okay. So do me a favor. We need to assess the seventh cranial nerve. So raise your eyebrows for me. Close your eyes real tight. Smile and frown. Want to assess the cranial nerve, the 12th cranial nerve. So what we're going to do, I need you to say light, tight, and dynamite.
Light, tight, and dynamite.
Okay, perfect. All right, so I'm assessing your skin temperature right now. Feels nice and warm. Capillary refill is under 3 seconds. Got really good turgor, no tenting. Okay, so what I need you to keep your feet down for me, sir, please. Okay, come down here. No swelling to your lower extremities. Do you experience swelling ever?
No, ma'am.
Okay, so what I'm going to do now is I'm going to assess 3 cranial nerves at once, and we're going to do the 6 cardinal fields of gaze. So we have 6 cardinal fields of gaze, which are the left inferior oblique, the left superior rectus, left lateral rectus, left inferior rectus, left superior oblique, left medial rectus. And of course, in your right eye, it's the right of all of those. So do me a favor, look up here, keep your head still, look right here, look down here, look over here, look this way, and look up here. Excellent. Now, did you experience any eye pain or anything when you were just doing that?
No, ma'am.
Okay. So, one thing I want to do now is I want to assess your ears. Have you had any issues with your hearing?
No, ma'am.
Okay, so what I'm going to do is I'm going to take my pen light. Where did my pen light go?
Stump's got it.
Nursing assistant, where's my pen light? There it is. So here's my pen light. What I'm going to do is I'm going to assess your ears and your eyes at the same time.
Okay.
Do me a favor. Close your eyes. Open them.
Mommy. Mommy. Get mine.
Okay. No redness, no drainage. Now follow my pen light. Keep your head still. All right. So his pupils definitely are equal, round, reactive to light. He's showing convergence and also accommodation when I move it close to his nose. And his other ear looks excellent. Okay. So I don't have an otoscope, but if I did, I would have looked at his tympanic membrane, and he never has issues with his ears, so I probably would have seen a perfect bubble there. Okay, so now what I'm going to do is I'm going to assess your frontal and maxillary sinuses. Tell me if when I push on any of these places, if you have any sensitivity.
No.
Okay. Stick your tongue out. This is going to be my, say ah.
Ah.
Okay, perfect. Okay. So look up. Nasal septum is even, no swelling, no drainage. I told you, sir, that's not going to be acceptable. Okay, so he's definitely got moisture in his mouth. The color is nice and pink. His tongue looks great. His teeth are all there. There's no lesions. And his uvula rose with phonation when he said ah. So 9th cranial nerve is definitely intact. Okay, so now we are going to get to the back. Can you turn to the side for me? I'm going to be listening to your breathing and doing some things. So just follow directions.
Okay.
Go ahead and take in a deep breath. And again. And again. And again. Okay, perfect. No consolidation. Stop. Air moves slowly. No rhonchi, no wheezing, no crackles, anything like that. So what I need you to do is I'm going to touch on certain areas of your back, and I need you to say 99 for me, okay?
Okay.
Say 99.
99. 99. 99. 99.
Perfect. No tactile fremitus in his back. Take 2 more deep breaths. All right, just breathe normally. All right. So what I just did, aside from feeling his lungs, listening to his lungs, was I listened to his heart sounds in the tricuspid, pulmonic, aortic, and microvalvular regions. I only heard S1 and S2. I didn't hear any audible murmurs. He didn't have any S3 gallops or any S4 sounds. So his heart is very healthy, which I knew because he's in extremely good condition. Very muscular, works out quite a bit. So now I'm going to move to your abdomen. Now what I'm going to do is, you've got normal active bowel sounds. I'm going to feel on your abdomen. So what I need you to do is just tell me if you feel any tenderness, any pain. All right, so I'm in the right upper quadrant of his abdomen, and I definitely can feel the lower border of his liver right under his rib cage right here. So,
I'll fix it.
so I'm going to move over to the left upper quadrant. I don't really feel anything here, which I'm not surprised by because he shouldn't have an enlarged spleen or anything like that. I'm not going to feel any kidneys because he doesn't have any kidney issues, so there's no reason why his kidneys should be inflamed or swollen to where I could feel it through the upper quadrant right here. I'm going to move into the lower quadrant, and here you can just kind of feel the descending aspect of his large intestine, his colon. It's obviously not too full because it's not hard. Let me come over here. You have any tenderness right here? Okay, so he doesn't have issues with his appendix. And also I can't really feel anything here, which tells me that his bowels are moving regularly and there's really no issues going on here.
Yeah, go get some.
Okay, so what I am going to do
Cheetah.
is palpate. You okay?
Yeah.
Palpate his joint. So let me see your hands.
Yeah.
Okay, so feeling his wrist joints right now, and I'm watching his face while I'm doing it. He's not wincing, he's not groaning, he's not really showing me any signs that he's got any issues with his wrist. And of course, as I move down through the phalanges, I can feel that everything is in line like it should be, and once again, he's showing no signs of pain. Knuckles all feel good. Alright. Put your legs down, please. Okay, so now I'm going to get to his joints. And the way that I'm going to do that is... So I'm going to do... Hold on. I'm going to do some deep tendon reflexes. So the first one I'm going to do is the patella. Your joints. Okay. The second one that I'm going to do actually is going to work really good on him because he's got a very muscular arm. So I'm going to do his arm joint. And basically what I'm looking for is when I tap his joint, this muscle kind of tenses up a little bit right there. So got positive reflexes.
Bye-bye.
Okay, so do me a favor. Put your finger to your nose. Now switch hands and put your other finger to your nose. Okay, now hold your hands both in front of you like this. Now hold them like this. And do that one more time. Okay, excellent. One thing I'm going to do
You're doing so good.
is listen to make sure that I don't hear anything in your carotid artery. Which I don't. Which means that you don't have anything like stenosis or atherosclerosis, which would be clogging up those arteries to where they would make an audible sound. So everything is looking good. Stand up for me right here. Okay. And just turn and walk, no, towards the fish tank. Okay, and walk heel to toe. And turn around and come back. Okay, sit down. Quit crossing your legs. Uncross them. Okay, put your hands out. Push up on my hands. Push down on my hands. Put your arms up. Push against me. Now push away from me. Okay. Push up against my hands. Whoa, push down on my hands. Goodness. You're strong. I knew you were strong. So what I'm going to do now is assess your pulses. Okay. I would actually grade him at a 3+ because he has quite big veins, quite big muscles. So he's definitely 3+, I would say, bounding. Really only mark his pedal pulses, dorsalis pedis and posterior tibial at a 2+. But his upper extremities, definitely 3+. So 3+, 2+. Okay, so it is extremely, one thing that I forgot to do that I want to do real quick, sir, is turn for me. And usually when I palpate the abdomen on my pediatric nephrology patients, I go ahead and do what my physician calls the Murphy punch sign. And it's just kind of a way for us to assess, on top of blood and urine work, if there's any kidney inflammation. So that's actually one that we do all the time. So sir, what I'm going to do is I'm going to kind of tap on your back. I need you to let me know if you have any sensitivity or pain when I do that.
No.
All right, sit back. You've done very well today. Thank you for being my model. That's inappropriate, sir. So this is Nikki Ramirez. Obviously, this was very out of my comfort zone to do this on camera, but it was kind of nice to have a refresher course of a full head to toe, because usually I kind of just focus on all the body systems that are related to nephrology. I hope that you enjoyed it, and thank you for watching.